A catheter is a flexible tube which allows urine to drain from the bladder into a bag. It has a balloon at the end which is in the bladder. This balloon is inflated to keep it in place. It may be inserted via the urethra, which is the passage through which you normally pass urine, or via a hole in the abdomen. Catheters are often attached to the bed or a stand, and if the person you care for can walk, they may have a leg bag which is strapped to the leg with elasticated straps. Catheters are usually changed every 12 weeks by a district nurse. Your role as a carer is to make sure that the skin around the catheter tube is kept very clean and ensure that the bag is emptied regularly. This is because catheters are a very common cause of urinary tract infections, often called UTIs, and they can smell, which can be upsetting for the person with the catheter. The bag should be emptied when it is 2/3 full. Open the tap at the bottom of the bag and let it drain into a bowl or directly into a toilet. Remember to close the tap. The bag should be changed weekly. There are extra large bags available for nighttime. Always wash your hands before and after touching the catheter. Twice a day, wash the skin where the catheter enters the body. In men, wash carefully under the foreskin, ensuring the foreskin is replaced after washing. In women, wash the genital area from front to back to avoid the spread of bacteria from the back passage. Waste catheters and bags can be disposed of in the normal household waste bin. If there is no urine in the bag, first ensure the tubing is not twisted and check the bag is below the level of the bladder. Also make sure the person you're caring for has had something to drink. If urine is leaking from around the edge of the catheter tube, ensure the tube is not twisted and empty the bag. If these simple measures do not solve the problem, then contact your district nurse. Catheters increase the risk of urinary tract infections. If the person you care for starts to feel unwell, has lower abdominal pain, or you notice the urine has become cloudy and smelly, contact their GP. If you have any questions about catheters, talk to the district nurse or GP.